Nicolas van Mieghem from the Erasmus University Medical Center in Rotterdam, and I'm going to discuss the 3-year outcome data from the FORWARD-PRO prospective study. The FORWARD-PRO is a prospective multi-center study evaluating the EuroPCR transcatheter supraannular functioning self-expanding heart valve in patients with severe symptomatic aortic stenosis, both native aortic stenosis and degenerated aortic bioprosthesis. It's a prospective study with echo core lab analysis of the echo data at pre-discharge, 1 year and 3 years, and also an independent clinical event adjudication. So the study design was according to the standards of good clinical studies that we have these days. So an independent core lab was evaluating the echocardiograms at pre-discharge, 30 days, 1 year and 3 years. There was also independent clinical event adjudication. The trial enrolled over 600 patients, and follow-up was complete for 87% of the patients at 3 years, which is quite okay. The mean age of the patients was above 80 years old, so 81 years old. The STS score was quite high, 4.7, and the majority of the patients included were female, were women. And the trial specifically was aiming not for the low-risk patients, but for patients at a higher operative risk. So the FORWARD-PRO was the main trial evaluating the supraannular functioning EuroPCR transcatheter heart valve, and the major innovation in that device iteration was the addition of a pericardial wrap to mitigate paravalvular leaks. At the same time, the device is repositionable and retrievable. The key outcomes are mortality was 25% at 3 years, and you could see an annual mortality risk of between 8 and 9%, which is totally in line with the risk profile of these patients. Again, these were not low-risk patients. These patients had a significant comorbidities, and also a third of the patients were considered to be frail. So expectedly, you would see some kind of mortality. At the same time, stroke rate was relatively low. The disabling stroke rate was 6% at 3 years, which also is completely in line with our expectations in this patient population, with an annual stroke rate after 1 year of 1%, as expected. Pacemaker rates were 22%, and we have to bear in mind that patients were enrolled in this study in the years 2018 and 2019. So we were not applying these new implantation techniques to lower pacemaker rates. There are two important findings, I think. First of all, there are no durability issues, at least after 3 years. So the valve performance was excellent with superior hemodynamics that we know with an Evolut platform. PVL was low. The majority of the patients had no or only a trace paravalvular leak. And the interesting finding is that 189 patients had echoes at pre-discharge, at 1 year and at 3 years. In those patients, we could tell that the rate of mild or more PVL was going down over time. And that was quite of interest, and it's for the first time that that has been demonstrated with a TAVI platform. And one of the hypotheses could be that the nitinol, which is the framework of the Evolut Pro, that keeps on expanding and becomes more circular as time progresses. So that is quite interesting. And another important observation is that the risk or the rates of thrombosis, valve thrombosis, endocarditis, and a need for a re-intervention were super low, less than 1%. So the next steps are basically what the community is already doing. We're moving to lower risk patients. Patients that are younger, have a lower life expectancy, so lifetime management becomes very important. Obviously, in those patients, you want to have a very reliable technology at hand, technology that probably should be repositionable and retrievable in order to optimize your implant, and also should include a sealing fabric to mitigate paravalvular leaks. Obviously, there's also the conduction issue, but with new implantation techniques, and that is the Optimized Pro study that also was presented here at EuroPCR, we are able to reduce the need for pacemakers to single-digit numbers.